Periodontal probes are essential diagnostic instruments in dentistry, specifically designed for evaluating the health of the periodontium. These tools help clinicians measure the depth of periodontal pockets, assess attachment levels, and detect bleeding upon probing. Their rod-like, tapered structure with a blunt, rounded tip ensures gentle yet accurate exploration of the gingival sulcus. Understanding how to use these probes correctly is fundamental for both routine checkups and advanced periodontal assessments. In this video, we'll explore the types, classifications, technological generations, and recent advances in periodontal diagnostic instruments, providing a comprehensive overview for students and professionals alike. A typical periodontal probe features a tapered, rod-like design calibrated in millimeters, ending in a blunt, rounded tip. This structure allows for precise measurement of periodontal pocket depths and spatial configurations. During clinical use, the probe is inserted with firm yet gentle pressure, reaching the base of the pocket. It's crucial to align the shank parallel to the long axis of the tooth surface being probed, ensuring accuracy and minimizing trauma. Mastery of this technique is vital for reliable diagnosis and treatment planning in periodontology. Periodontal probes serve multiple diagnostic functions. They measure pocket depth, assess attachment levels, evaluate bleeding on probing, and examine furcation areas. Specialized probes like Nabers are used for furcation detection due to their curved and blunt design. These functions are critical for identifying periodontal disease severity, monitoring progression, and guiding treatment decisions. The versatility of periodontal probes makes them indispensable in both general and specialized dental practice. Periodontal probes are broadly classified into color-coded and non-color-coded instruments. Color-coded probes, such as the Marquis and UNC 15, feature distinct markings for easy visualization. Non-color-coded probes, like the Williams and Michigan O variants, rely on engraved millimeter markings. Each type offers unique advantages in clinical and research settings, enhancing visibility, precision, and reducing reading errors. Understanding these classifications helps clinicians select the most appropriate probe for each diagnostic scenario. Several manual probes are commonly used in clinical practice. The Marquis probe is color-coded in 3 mm sections for quick reference. The UNC 15 probe, preferred in research, features millimeter markings with color coding at 5, 10, and 15 millimeters. The Williams probe combines color and non-color coding, omitting 4 and 6 mm markings to improve visibility. Michigan O probes come in variants with Williams style or standard markings. The WHO probe includes a 0.5 mm ball tip and color-coded bands, while Naber's probe is specialized for furcation evaluation. Each probe is tailored to specific diagnostic needs. Furcation areas, where roots diverge, require specialized probes for accurate evaluation. Naber's probe, available in both color-coded and non-color-coded variants, is designed with markings at 3, 6, 9, and 12 millimeters. Its curved and blunt structure allows clinicians to detect and assess furcation involvements effectively, which is crucial for determining the extent of periodontal disease in multi-rooted teeth. Proper use of these probes ensures comprehensive periodontal assessment and guides targeted treatment strategies. The evolution of periodontal probes spans 5 distinct generations, each aiming to improve diagnostic accuracy, reduce examiner bias, and standardize probing forces. From manual probes to advanced 3D and non-invasive systems, technological advancements have revolutionized periodontal diagnostics. Understanding these generations helps clinicians appreciate the progress in instrument design and select the most suitable tools for their practice. First-generation probes are conventional manual instruments that do not control probing pressure and are unsuitable for automated data collection. Despite their limitations, they remain the most widely used tools in general clinical practice. Examples include the Williams Michigan O, UNC 15, Nabers, and CPITN probes. CPITN probes feature a 0.5 mm ball tip and are divided into epidemiologic and clinical variants, each with specific markings for screening and monitoring periodontal health. Second-generation probes are pressure-sensitive instruments designed to provide improved clinical standardization by applying a controlled probing force, typically set at 25 grams. Examples include the True Pressure Sensitive TPS probe, Armitage Pressure Sensitive probe, and Van der Velden probe. These tools help reduce operator variability and enhance the reliability of periodontal measurements, making them valuable for both clinical and research applications. Third-generation probes introduce computer-assisted systems with direct data capture, minimizing inter-examiner bias. Examples include the Foster-Miller probe, Florida probe, and Toronto automated probe. These instruments feature controlled pressure and automated detection of key anatomical landmarks, such as the cement-enamel junction, CEJ. Advanced precision in probe angulation and electronic data recording make these probes ideal for research and high-precision clinical settings. Fourth-generation probes are three-dimensional, 3D instruments engineered to record sequential probe positions along the gingival sulcus. Fifth-generation probes advance this technology by integrating ultrasound or other imaging modalities, allowing for non-invasive identification of attachment levels without physical penetration. The ultrasonography US probe exemplifies these innovations, utilizing ultrasound waves to detect, image, and map periodontal structures. These developments represent the future of periodontal diagnostics. The National Institute for Dental and Craniofacial Research, NIDCR, introduced specialized criteria to address the limitations of conventional manual probing. Conventional probes measure in 1 mm increments, while NIDCR criteria offer high precision at 0.1 mm. The probing force is standardized and non-invasive in NIDCR systems, with integrated guidance and direct electronic readout. These advancements improve precision, reduce operator dependency, and enhance data security and sterilization capabilities. Dental implants require specialized care using non-metallic instruments. Plastic probes and gold-coated curettes are specifically designed for titanium and implant abutment surfaces. The clinical rule is to always use plastic rather than metal instruments on implants to prevent scratching, scarring, and permanent structural damage. This ensures the longevity and integrity of implant restorations, safeguarding patient outcomes. Explorers are diagnostic instruments used to locate subgingival calculus deposits and evaluate root surface smoothness after root planing. They come in various shapes and angles, including shepherd's hook, straight, curved, and pigtail, cowhorn, explorers. These tools are essential for thorough periodontal assessment, ensuring that all calculus is detected and removed, thereby promoting periodontal health. Recent advances in periodontal diagnostic instruments include innovative technologies such as Detectar, Perioscan, and Keylaser 3M. Detectar uses a spectro-optical approach with LEDs and fiber optics to detect subgingival calculus. Perioscan employs ultrasonic acoustic devices to differentiate between calculus and healthy root surfaces. Keylaser 3M utilizes a diode laser system for precise calculus detection. These advancements enhance diagnostic accuracy and streamline clinical workflows.